Everybody's got a story to tell, and most of the time they're appreciative to have an audience, and they do understand that they are, training doctors for tomorrow, really. I mean, maybe their physician or somebody else in their family who benefits from that. I do think, by and large, they feel like they have a story to tell, and they're appreciative for us listening and trying to learn from that.
Patients in the clinic have been pretty open, and I think they're happy to have someone who doesn't have a time crunch to actually listen to their whole story.
They have gone through this very detailed story with multiple people already. There's an ER nurse they usually have dealt with, or maybe an ER physician, and then one of us comes along, and then when they get admitted to the floor, another team of nurses has to interview, and it's really fatiguing to tell the same thing over and over again when you're not feeling well.
Some patients, they're just so miserable, they really don't want to tell the same story again. So to have to go through everything from why they're here today, what sort of past medical history they've had, all their allergies, social history, everything, it's just very tiring, and they're not feeling good anyway. So I don't blame them at all.
There are some patients that get a little uneasy, like, oh God, I'm in here with just a student, like what are they going to do now? And then there are patients that they just continue the conversation like nothing happened. And may even tell you something that they didn't necessarily want to tell the physician because there was a little discomfort with them. They felt just a little too vulnerable or whatever the case may be, and they end up telling you, and that can go a long way because it might impact their therapeutic plan.
I haven't had too many experiences where the preceptor is in the room. For this third year, I've actually been sent into the room on my own most of the time.
This is the 7th or 8th time today I've had to tell this story. After 12 hours of this, yeah, it gets a little bothersome, but yeah, I mean, I expect it because they all got to know the whole history so they can come up with their own diagnosis. Whether they're a med student or have been practicing for a while, I don't hold back information. I trust the practicing doctor a little more than the med student just because they're still learning, but as far as holding back information, no.
Yeah, that comfort or that trust has been established. They already know this person. They've seen them once during their care, and maybe it's day 2 on follow-up. And again, many times the students are hours ahead of the attendings in terms of getting to people, so it actually, patients feel like they're being attended to. And so for us, I think it may help us bridge some of that gap in time where they're waiting to see somebody.
Patients absolutely have to be open to talking to you as a student, and if they are, it makes the interview that much easier. There's also been some experiences that patient didn't want to have anything to do with the student, and so all you can do is, ultimately it's the patient's right to whatever they want, pretty much. So they, if they refuse to talk to the medical student, they refuse to talk to the medical student, and you can certainly try, but in the end, it's only what they want that matters.